AM 1480 WLEA. Right now we're joining Steuben County Public Health Nurse Darlene Smith, Sheriff Jim Allard, and the Director of Emergency Services Tim Marshall over in Bath for a press conference. Tim Marshall starting things off.
So we are doing our weekly press conference with you to kind of give you an update on current situation with COVID-19. And I'm going to start with Darlene Smith from our Public Health Department.
Good afternoon. This is Darlene. I wanted to give you numbers as they stand right at this moment. We have a positive COVID case count of 92. That number will increase by the end of the day in our releases. We're working on some positive cases right now, but are not complete yet. We have, in terms of testing, we've completed 668 tests. 525 of those are negative. We have about 241 in isolation and quarantine at the moment. We have 30 who have recovered. We have 13 patients in the various hospitals across the county and 17 who are positive in nursing homes. And we also stand at 6 deaths and possibly one other that is pending.
Thank you, Darlene. This is County Manager Jack Wheeler. The other thing that we wanted to focus this week's press briefing on is the press release that we sent yesterday in conjunction with Director Smith, Sheriff Allard, and District Attorney Baker about enhanced enforcement of New York State on pause, the executive order that the governor issued under public health law and other laws for the enforcement of different social distancing practices, and we thought it important for the sheriff, as our chief law enforcement officer, to give an update to the press.
Afternoon, everybody. In working with the district attorney's office and with the county manager, public health, and the emergency management office, we have taken some time and looked through the various mandates from the governor regarding enforcement of pause. We believe that we have a good plan for the citizens of Steuben County moving forward. Obviously, compliance is our primary goal. Anything that we can do to gain compliance with social media distancing, with non-essential gatherings of individuals not occurring, that's what we would like to see in order to slow the spread of this virus. We have absolutely no desire to take enforcement action in any of these situations. However, enforcement is always on the table if we can't gain compliance through education and people being voluntarily doing their civic duties. In Steuben County, we're lucky that we have a great population of folks that take care of their neighbors and watch over their communities, and I think that they'll continue to do so as we get more information out and more education out to folks, why it's important, how it's important, and how costly non-compliance could be. I think you'll continue to see compliance go up, and hopefully we can stem the spread of this virus. We do have methods of causing enforcement, but again, our goal is compliance through education and voluntary compliance from citizens as they look out for their neighbors and their community.
Thank you, Sheriff. This is Jack Wheeler again. I think the Sheriff hit that perfectly. We see the comments, we see the questions on social media and others about enforcement of this. Sheriff laid that out perfectly. We get questions of, I like to take a walk around the block with my wife at night. Can I still do that? Of course. I mean, this is common sense stuff. Of course, you and those that you live with in your household. So if you have, a wife, a husband, a loved one that you live with and children, going outside and getting some fresh air, there is nothing wrong with that. What we're talking about are large groups gathering in parks, people meeting up, as we've talked about, and as we keep getting reports on, to go grocery shopping together that aren't immediate family that live in the same household. Those are the things. Those are social interactions. Those aren't the common sense, I want to go for a bike ride, around my neighborhood. No one's going to be policing that. This is really focused on those non-essential social gatherings. With that, I think Tim will lead us and we'll take questions.
So let's start off questions with Brian O'Neill at WLEA.
Hi there. This is for public health nurse Darlene Smith. Darlene, you say that there will be an increase in the number of cases, currently 92, but before the day's up, there will be more. Can you say at this point how many more?
No, I really can't yet. I mean, we get our list off of electronically off of our database every morning. There is a number there, but we are in the midst of checking those, and even more numbers can come in throughout the day. So it's kind of a moving target at the moment, but I'll certainly have a lot more information readily available for the media later today.
Sure thing. Do I have time for another question?
Sure, Brian, go ahead.
This again for the public health nurse, Darlene. Social distancing. There's been some talk on Facebook, I understand, questioning the whole social distancing concept. Was wondering if you wanted to speak to that in terms of what your statistics show in terms of results from social distancing.
So, as you know, we've been pretty consistent in our message to all of Steuben County about the importance of social distancing and to stay home. And as you've probably also noticed in recent press releases, that when we announce that we have X amount of more positive cases, that the number of community exposures that we list in that press release has also decreased. And we believe that that is because of our efforts at messaging the social distancing as well as the community's efforts in abiding by them. And you may have also noticed in press releases that a number of new positives are, we can directly correlate them back to some previous positive cases. So meaning, we're in contact with them, likely a family member or a close friend or what have you. So we believe that our messaging and the community's response is beginning to work, but that doesn't mean it's time to let up on it.
Thank you.
You're welcome.
So James Post from The Leader.
Hey, I'll start by directing this to Sheriff Allard, and then, he can redirect it if there's maybe somebody who's in a better position to answer. First off, I'm just wondering if there's going to be specific communication with the media about enforcement activities that take place, or will that just be included in normal sort of press communication about arrests if that happens?
Probably both, James. We'll do an immediate press release of any misdemeanor or higher arrest, as we've always done, but tying it in with what we're trying to achieve here with compliance in the communities, that would definitely be part of the daily briefing, I would assume, also. Okay.
And if I can just add on, I wanted to ask Darlene, what are you doing, what are you empowered to do regarding the number of infections that the county is seeing in nursing homes?
Well, the local health department does not have regulatory oversight of nursing homes. The State Department of Health does. So they oversee their policies and procedures, infection control, all of those things. It is the local health department's responsibility to follow up on these individuals who end up testing positive, and we provide the active daily monitoring of the mandatory isolation order for those individuals, just as we would anyone in the community.
Okay, and that's kind of why I wanted to ask, because that was my understanding as well, but I wanted to clarify that that's actually not your direct purview as far as the nursing homes go.
Well, that's correct, and we have engaged New York State Department of Health to assist in this county in these situations, and they are actively engaged with us.
All right, thank you.
You're welcome.
Spectrum News, Rochester.
Yes, in regards to the fine, if someone disobeyed these laws, I know the governor increased it from 500 to 1,000. So what went into the deciding factor for you all to have it as a $2,000 fine?
Sheriff, you want to take that, or you want to?
I don't care. The $2,000 fine was established also by the governor in one of his executive orders. Fines in any kind of adjudication will be under the purview of the criminal justice system should an arrest occur. The $2,000 fine, as mentioned, is a civil penalty that would be assessed by the state to a business or event coordinator that would be in violation.
And I know some places will your guys be out on patrol actively looking, or will you only respond if you get a complaint or something like that?
Both. We're responding to complaints as they come in through the hotline or through notifications that we receive either via social media or by tip, and each one of those is investigated and a report is generated at the conclusion of that. But also, if our deputies on patrol see what appears to be an obvious violation of a non-essential gathering, then they will go over and speak with the folks, educate them, and attempt to gain compliance.
Right. And final question, I know for our area, for the size of your county, you all have like a significant number of cases. Anything you can say to just the population of Steuben County and the number of cases that you have, and how is it on the county government? How is it on your response team? Any toll that it's taking?
Well, as of late, we've been experiencing clusters of the outbreak in our nursing homes, and that lately is what has driven the numbers up significantly.
That's all I have.
Okay, thank you. WFLR, is that Lucas that I heard?
Hi, Darlene. A question for you with obviously the Easter holiday coming up this weekend. Any guidance that you can give to residents that are thinking about possibly getting together? Should they maintain their social distancing or, again, maybe postpone events until a future date? How about some guidance there?
Yes, and actually we're going to be releasing a graphic around that very topic very soon, but we are still, despite the Easter holiday coming up, I know that many families have traditions related to that, but we will still be strongly encouraging and recommending the staying at home and social distancing. Certainly, if the families that live together can celebrate together in their homes, and perhaps I know a lot of families each Sunday watch their worship services on TV because the churches are live streaming them now, so it makes it a little easier. So hopefully, many families will be able to participate in that way, and just unfortunately adjust a little bit to a different way of celebrating Easter this year.
Okay, thank you for that.
You're welcome.
Mike Baldwin, WVIN.
Actually, you've already addressed my concerns. Thanks so much.
Okay, very good. I heard another person enter the conference earlier when we were on. If there are any other questions?
Yeah, no, sorry. This is Ashley Gafaro with WENY. I think all of my questions are answered.
Okay, thank you, Ashley.
And also, this is freelance journalist Natalie Abruzzo. I had a question.
Go ahead, Natalie.
So thank you so much for doing this conference. My question is actually directed to Mr. Wheeler. I have on good authority that you requested 100 sample kits for a problem in a specific nursing home. Can you elaborate on that?
So we did request additional.
I'm sorry. It's from Tompkins County, and you received 200.
No, we received 100 from Tompkins County. So we are looking to source additional personal protective equipment and test kits. either through the private market or through the state. Certainly, we request all of those things through the state. We are very grateful. Both Tompkins County and the St. James University of Rochester have helped us, and we did have experienced a need for additional testing in recent days. We don't have any more information to share at this moment on that, but yes, Tompkins County really stepped up. We thank Jason Molino, the county administrator in Tompkins County, for helping us fill a need.
Thank you. Can I ask a follow-up?
Sure.
So when you say you don't have anything more to add to that, does that have to do with because it's around a specific nursing home, or is there an issue with testing people just in the county itself?
We are working with hospital systems and others for testing purposes, as we always do. But we are currently conducting investigations and don't have information to release at this time.
Okay. Thank you so much.
Yeah.
WETM, did you join? Okay. Any other further questions? If not, we'll thank you for your calls today.
Hey, James Post with the leader. I just had one more follow-up.
Yes.
And again, I'll leave this to whoever feels like they're best positioned to answer. We've, as members of the media, we're following these releases day to day, seeing the larger number of infections, and obviously, unfortunately, the increasing number of deaths. And that's getting to the public. If those numbers aren't motivating people to follow the social distancing guidelines, is there enough enforcement capacity to actually deter people if that doesn't?
Well, enforcement capacity would be, this is Jack, enforcement capacity would be a question for the sheriff. I mean, obviously his resources, like all of ours during this time of crisis, are stretched thin. The goal, as the sheriff said, is not enforcement, it's education. And like you said, James, the death rate is alarming. The case rate is alarming. We have good news that we share as well about the recoveries and about how fantastic the community is stepping up in this time. We have so many people out there who are making homemade masks and gowns for last resort for hospitals and nursing homes. So there's so much good going on, but we need to make sure that if the need arises, we have a hammer to use, our law enforcement has a hammer to use if businesses or individuals don't get that education. Like the sheriff said, I personally, like all of us, being from here, I think we have a great community. I think people will respond once the message, this additional message gets out there. I think what we're seeing is as time goes on, it's harder to stick to social distancing. I'm looking out the window. The weather's not so nice right now, but, the weather past few days has been nice. People want to get out. Getting out is fine. It's keeping that social distancing. So we want people to stick with that. We're going to do it through education, but we do have enforcement capabilities should they not.
Okay, and if I could just follow on from that, you said, as time goes on, it's harder to stick to these rules. And if I could just, throw in, because it's something I've experienced with my own life and my own family, that when this first started, the thought was, keep shopping to a minimum. And as that's gone on, the cupboards have gotten barer and barer. And now, as the situation is worse and we're being told more strictly to stay home, we have more need to be out.
Sure, and there certainly is that need, but what we're not saying don't go to the store or don't go to the pharmacy. We're saying don't go in groups and limit, unless people can't get their hands on really essential products, there's no need to go to the grocery store every day. Plan your trip, Try to do it once a week. So everyone has to go out, and no one's saying that you can't go out of your house or you shouldn't go to the grocery store or a retailer or a pharmacy. It's be smart about it. Shop solo if you can. Some people can't. Some, single parents have to take their kids. That we understand that, but it shouldn't be a group of 6 meeting up with another group of 6 to walk through the store.
All right. Yeah, I get that.
That's
all for me.
And we've also been working with, with Wegmans and Walmart and Tops and the other retailers, to talk about social distancing and monitoring. Walmart this week has started instituting metering of folks in the store, based on the discussions that we've had with them. And we think those conversations have been great. And we really love partnering with those agencies that are doing that. So, that's where we're all working together to try to get to the end of this, this situation we're in.
All right. Thanks, Tim.
Brian,
all right,
WLEA again?
This is
all right, one at a time, I guess.
I guess one final follow-up question. I know a lot of the bigger counties have been getting most of the testing. Do you all have any concerns about the amount of testing kits that you have in the county and just the need for more given the amount of cases you have?
Yes, I mean, we can always use more. We've never had enough. We still don't have enough, and I don't expect to have enough tomorrow. But that's why we have reached out, and some of our other partners have helped us out, and I wouldn't be afraid to ask again. But we placed an order for test kits a month ago, and we still don't have them. So test kits is always a concern.
In a certain situation with testing as well, is we know a significant number of people in the community have the disease that have not been tested, but based upon their symptoms, we assume that they have the disease. So the biggest message with that is the fact that if you are not feeling well, stay home. If you're not feeling well, don't go to the grocery store. Don't go to the pharmacy. Have somebody else go and get those products and things that you need, and stay home and isolate yourself and keep the community safe and stop the spread. So, that's the biggest thing we have with testing. I think I also heard Brian there as well. Brian, did you have another question?
I had actually three, if you have room for that much.
Go ahead, Brian.
Great. Starting out with Darlene Smith, and this is a follow-up to what Tim Marshall just said there from Emergency Services. Suppose you know somebody who's got all the symptoms, and they're just one of those people who drag their feet on going to the doctor or calling the doctor's office. What do you say to somebody like that?
We still strongly encourage them to go see their primary care physician, and in hopes that maybe that doctor can talk them into it. And of course, we also always want them to call prior to arrival, because many offices have made separate entrances for those with symptoms. But we do our best. We talk to them and strongly encourage them to still see their provider.
Darlene Smith again. It's Brian O'Neill again. When a COVID-19 patient's in a nursing home or a hospital, are there extra precautions? For example, when you go from patient to patient, do you have to clean up and change gloves from finishing one patient before going to another?
Yes, within the healthcare facilities, if they go from one patient to one positive patient to another patient, then they need to be changing their PPE.
And the final question for Tim Marshall. With the upcoming heavy winds on the way, do you think shelters will be needed? Has there been any talk of that for people that are in power outage situations in Steuben County?
Yeah, I mean, typically in our windstorms that we receive around here, you may see some power outages. Certainly NYSEG and the other electric companies in the county do a great job at getting out and getting power back on for us. But, we always hope that power outages are to a minimum, and that's not going to be a requirement. But we would work with our partner agencies to see what we could do as far as staffing up shelters if needed. But, again, because we're a rural community, Brian, we see a lot of people, try to get through a day or so without power. That's been pretty standard. I mean, we've opened shelters in the past when we've had storms, and nobody comes. So, I think people in our area are pretty resilient, and I think they have enough supplies on hand and alternative heating sources and things. And, of course, the weather's not 10 below zero anymore. It's fairly nice, so you shouldn't see any issues like that, I wouldn't think.
Sure thing.
Hi, this is Natalie Abruzzo again. Can I ask a question? Do you have time?
Sure. Go ahead, Natalie.
Thank you so much. So this is either for Tim, Jack, or Darlene, whomever you think should take it. It's about the amount of PPE that's accessible and going out to the nursing homes. Can you please explain to all of us how much is on hand, how much is accessible to nursing homes, and if that process is going through like the owners or the administrators, and is it difficult for nursing homes to get their hands on enough PPE?
So throughout this process, and I talked about this on our last conference call, and I don't believe, Natalie, you were on with us at that point in time, but as you can see nationally, internationally, there are PPE shortages. We have worked very closely with our state and federal partners to solicit PPE and provide that out to the agencies within the county. We have received 2 pushes from New York State of personal protective equipment from the Strategic National Stockpile. We prioritize our needs based upon level of priority, hospitals, nursing homes, down to, EMS agencies and home health care agencies, and we push resources out, throughout the event. So basically, we work with the agencies directly and push out what their needs are based upon their needs. This is a war. This is not one battle. It's going to be a long period of time. So we try to work with our partners and get the PPE that we need when we need it and push it out as it's needed.
So I have one quick follow-up, if you don't mind.
Yep. Last question, please.
So if you're getting enough to the people, is there any way that you can explain how nursing homes in particular are having trouble having enough to make changes, to change their PPE throughout the day? And also anybody in law enforcement that might have issues having PPE in the jails?
So I can answer on the healthcare side. So the healthcare side, again, there's regulations put forth by the CDC and New York State Department of Health that requires them to, provide certain protection measures in place for their facilities. And it all depends on the number of cases that they have in their facility on how much PPE they're burning at any given time. So, we work closely with them to try to support them with that. And we monitor that on a daily basis with conference calls that we have with the hospitals and nursing homes every day. Plus, they report up to the state with the level of PPE that they have, and we monitor those reports. And, we prioritize based upon the level of care that they're providing, with hospitals, being one of our major hospitals and nursing homes being a couple of our major contributors. As far as the jail, we've got PPE that we've provided for the Sheriff's Department and his folks. Mr. Allard, Sheriff Allard, if you'd like to say anything more to that, feel free.
We're feeling very good about what's going on inside the jail right now. Through our isolation and screening, we've been able to contain it to, I don't want to jinx myself, but 0 cases, 0 symptoms, both inmates and employees. We have PPEs available and use them daily. Obviously, the longer this takes, the more difficult it's going to be to meet the need for PPEs. But at the current time, we are able to meet that need.
In addition to that, Natalie, just to close things out, we as a county have also worked forward to procure additional PPE that we can supply, county agencies with the hospitals and nursing homes. So, the county is taking all steps we can not only do we receive pushes from the state and the federal government, but we also have reached out to procure supplies as well. So, we're working with our neighbors and partners, like you had mentioned with Tompkins County and the test kits. If they've got test kits and we can use them, we're partnering with them. So those are the things that we're doing to try to get through these shortfalls.
Thank you.
Thank you, folks. With that, we'll close the call, and we will have another call next week. Thank you for your time.